Covidiots on the prowl. Eid shoppers throng markets. Hyderabad left horrified. Charminar area turns into a crowded free-for-all. And all this while Telangana records its biggest ever spike. COVID safety loses out to faith. Festive revelry over saving lives.
These images that have come in earlier today from Medinipur in Bengal, just a few days after the results were announced, violence continues to escalate. This time caught on camera, Union Minister Muralidharan of the External Affairs Ministry has his convoy attacked by locals in Medinipur. The BJP says these were Trinamool members and Trinamool workers who attacked his car. It's all been caught on camera. As always, great to see you here on 5 Live. I'm Shivarur. Let's get you straight to the headlines. After the Supreme Court's criticism, Centre supplies 730 metric tons of oxygen to Delhi. Chief Minister Kejriwal thanks the Modi government, urges them to ensure uninterrupted supplies every day. Top government advisor warns of a third COVID wave, calls it inevitable. Maharashtra Chief Minister also expresses caution as Supreme Court advises Centre to build up medical infrastructure. Congress accuses BJP MP Tejasvi Surya of communalizing the bribe for bed scam in Bengaluru. Questions the singling out of Muslim employees working at the BBMP. Biden administration supports waiver on vaccine patents. World trade negotiations expected soon. Prime Minister Modi had spoken to the US President on this issue last week. Debris from Chinese rocket hurtling back to Earth after space station launched by China. Scientists aren't sure where it will come crashing down and what kind of damage it could possibly cause on inhabited areas. Yesterday we showed you images of religious festivities in Gujarat. The scene now shifts to Hyderabad, outside the Charminar, where Eid al-Fitr festivities are drawing closer. Huge crowds were seen thronging markets without following any guidelines, social distancing or masking. The iconic Charminar in Hyderabad and the market nearby was flooded with festive shoppers who threw social distancing norms straight out of the window. Who would you blame more? The people or the authorities who've allowed this to happen?
Hundreds of people out shopping. That's right, shopping in this huge crowd amidst the second wave. No question of social distancing. May not even be bothering to wear a mask. This is the iconic Charminar in Hyderabad. You'd expect that amidst a deadly second COVID wave, that markets here would wear a desolate look. It's, however, exactly the opposite, as you can see. Hundreds of people throng the markets in old Hyderabad as Eid al-Fitr festivities draw closer. These Covidiots have chosen festivities over their lives, and this as cases are alarmingly rising in the city of Hyderabad.
There are boards like this, wear mask or you have to pay ₹1,000 for mask violation. But the reality at ground, this is Charminar, the famous monument of Hyderabad, and you can see hundreds of people are here for Eid shopping, Eid celebration, and the entire area is crowded, entire area is filled with people, and this is just afternoon. The day will progress, more crowd will throng and more crowd will gather at this place.
Has any action been taken by the authorities? Nothing yet. With only a night curfew imposed so far, nothing has been done by authorities to stop this kind of super spreading ahead of festivities. This kind of overcrowding is a matter of serious concern and has led to several experts demanding a lockdown before Eid. But the Telangana Chief Secretary claims all is well.
The government knows that the situation is under control, and we also know that lockdown valna pedda upyogam ledu. We have to be careful. We have to follow the treatment protocol. Our hospitals lo evaru vasinappudu valki manchi treatment iste and evarki initial symptom vachinappudu ee medicine anni tinte evarki samasya raadu.
The coronavirus cases in Hyderabad are low when compared to other cities, but what is a matter of concern is these kinds of scenes at markets in old Hyderabad and the lack of testing, something that the Telangana High Court also slammed the KCR government over. We've seen how gatherings have led to a huge surge in coronavirus cases across the country, and it was this laxity and neglect that led to the second COVID wave that has ravaged and is continuing to ravage the country. But for authorities and citizens here, faith and festivities matter more than their lives. With Ashish Pandey in Hyderabad, Bureau Report, India Today.
Let's just show you what the COVID outlook is like in Telangana right now. The number of cases in the last 24 hours stands at 6,361 in the state. The number of deaths in the last 24 hours is 51. The number of active cases, which has been rising in the state of Telangana, stands at 77,704. Let's also tell you that the number of vaccines administered in the last 24 hours is 78,262. Vaccine wastage in Telangana is relatively low at 0.52%. So it's a state that has relatively low active figures and the daily caseload. But is that something that should be a situation where caution is thrown to the wind? Take a look at how Telangana in many ways has been a repeat offender. Today it's at the Charminar, or rather yesterday it was at the Charminar, but there have been multiple occasions when COVID norms have simply been thrown to the wind. You saw the campaign rallies, huge crowded campaign rallies during the second wave that happened last month in Warangal and elsewhere during the municipal elections. The TRS, the BJP, the Congress, the left, all were perpetrators of this crime. They were all Covidiots at that time. Then you had cinemas being attacked during the release of Pawan Kalyan's films, where huge crowds behaved in this very, very disturbing manner. Crowds vandalizing theatres. So Telangana has seen a lot of Covidiocy, if I may call it that, in the recent past. And that's why we wanted to highlight today's story as well. The Hyderabad police has now reacted for the first time after India Today has highlighted this story. Take a look at what the Hyderabad police is saying.
So we have booked a total of 5,925 cases for not wearing masks, 661 cases for not maintaining social distance, 16 cases of large public gatherings. We also booked 4 cases for consumption of liquor, pan, gudka, tobacco, etc. in public places. And for night curfew violations, we've booked a total of 1,056 cases. Total fine enforced so far has been 59,25,000. So enforcement activity also has been carried on. And we are also enhancing the enforcement in the wake of the spread of COVID-19.
From Telangana to Karnataka, where politics has exploded after BJP MP Tejasvi Surya has revealed a bed for bribes scam going on at the Bengaluru Municipal Corporation war room that is responsible for bed allocation. But this entire bed scam has taken a huge communal twist, with the opposition Congress party pointing an angry finger at Tejasvi Surya and saying that he is using this scam to target Muslims. Take a look.
The unearthing of a massive hospital bed scam by a BJP MP in Bengaluru has taken a sharp communal turn. BJP MP Tejasvi Surya claimed to blow the lid off a racket in which the city's civic body, the BBMP, was also involved. Officials of the BBMP have been caught taking bribes for allotment of hospital beds reserved for COVID-19 patients. But what's attracted the opposition's ire is this video of Tejasvi Surya.
17 ಜನ ಮನ್ಸೂರ್ ಅಲಿ, ತಾಯಿರ್ ಅಲಿ ಖಾನ್, ಸಾದಿಕ್ ಬಾಷಾ, ಮೊಹಮ್ಮದ್ ಜಯದ್, ಅಲ್ಸಾಯ್ ಸಯೀರ್, ಉಮೇರ್ ಖಾನ್, ಸಲ್ಮಾನ್ ಹುರೀಫ್, ಜಮೀರ್ ಪಾಷಾ, ಜಬಿ ಉಲ್ಲಾ ಖಾನ್, ಸೈಯದ್ ಹಸ್ನೈನ್, ಸೈಯದ್ ಶಾಹಿದ್, ಶಹೀದ್ ಶಬಾಸ್, MD ಯೂನಸ್, ಸೈಯದ್ ಮೊಯಿನ್ ಶಾ, ಸೈಯದ್ ಮುಯೇಶ್ ಶಾ, ಅಲ್ಸಾಯಿನ್.
Who is this?
Who are these people?
The Congress has latched on to this footage to accuse the BJP MP of communalizing the bed scam.
Whoever is an accused, whether it's from Muslim or Hindu community. So if 17 people belonging to Muslim community work in a war room out of 212, and for that also they don't tolerate 17 people out of 200 means, what is your sabka saath, sabka vikas?
17 ಜನ ಮನ್ಸೂರ್ ಅಲಿ.
Tejasvi's video has also led to sharp reactions on social media. Bollywood actor Siddharth even going to the extent of calling Tejasvi the next Ajmal Kasab. The scam has also backfired on the BJP government, with opposition leaders and many within the party also lashing out at the state and centre.
The allotment is there. See, whoever does offence or go against the rules, let them be punished. You please ask him to go to Prime Minister and ask the Prime Minister to allot more oxygen, the required quantity of oxygen to Karnataka.
ಇವತ್ತು ನಾವು ಆರೋಗ್ಯ ಸಚಿವರು ನಾನು ಟೀಕೆ ಮಾಡ್ತೇನೆ. ಇವತ್ತಿನ ಘಟನೆ ಒಂದು ನಮ್ಮ ಪಕ್ಷದ ಸಂಘಟನೆಗೂ ಮುಜುಗರಾಗಿದೆ, ಎರಡನೇದು ನಮ್ಮ ಸರ್ಕಾರಕ್ಕೂ ಮುಜುಗರಾಗಿದೆ. ಮುಖ್ಯಮಂತ್ರಿಗಳು ಯೂನಿವರ್ಸಿಟಿಯಲ್ಲಿ ಎಲ್ಲ ಕಾಲಕಾಲಕ್ಕೆ ಮೀಟಿಂಗು ಮತ್ತದೆಲ್ಲವೂ ಮಾಡ್ತಾರೆ. ಆದರೆ ಆರೋಗ್ಯ ಸಚಿವರು ನೀವು 2 ಖಾತೆ ಬೇಕಂತ ಹೇಳ್ಕೊಡ್ತೇವೆ. 2 ಖಾತೆ ಯಾದಕ್ಕೋಸ್ಕರ? ಒಂದು ಮೆಡಿಕಲ್ ಎಜುಕೇಷನ್ ನಿಮಗೆ ಬೇಕು, ಹೆಲ್ತ್ ನಿಮಗೆ ಬೇಕು, ಹಂಗೆ ನಿಮ್ಮ ಜವಾಬ್ದಾರಿ ಏನು? ನಾನು ಹೇಳಕ್ಕೆ ಇಚ್ಛೆ ಪಡ್ತೀನಿ, ಇವತ್ತು ಕೆಲಸಗಳನ್ನು ನಿರ್ವಹಿಸಕ್ಕಾಗಲ್ಲ, ರಾಜೀನಾಮೆ ಕೊಟ್ಟು ನಾನು ಬೇರೆ ನನಗೆ ದುರಾಸೆ ಇಲ್ಲ, ನಾನು ಮಂತ್ರಿ ಆಗಬೇಕಂತಲೂ ಖಂಡಿತ.
Meanwhile, the Karnataka police has cracked the whip on this racket, arresting 3 virus vultures. The modus operandi of the Bengaluru bed scam runs something like this. Step 1, citizens calling for beds are immediately told no beds are available. Then in some instances, a bribe is demanded for allotment of beds under the government quota. A bed is then blocked in the system for 12 hours, during which the deal is done with the desperate patient. If the deal doesn't go through, the bed is back in operation for the next bribe attempt.
Now the BBMP bed scam has descended into a communal political fight between the Congress and the BJP, with the opposition accusing Tejasvi Surya of targeting one particular community. So while the politics rages on, it's the people of Bengaluru who are suffering and struggling to find a bed amidst the second wave that has hit the city hard. With video journalist Madhuar, Nolan Pinto for India Today.
And let's show you what the Karnataka numbers are now. The Karnataka COVID tally in the last 24 hours stands at 50,112. That's a huge spike, one of the biggest in recent times. The deaths in the last 24 hours is 346. The cases in the last 24 hours in Bengaluru alone, 23,106, making it one of India's metros with the highest daily caseload. The number of vaccine shots administered in the last 24 hours, 163,151, with a wastage percentage of just 0.14%. But Bengaluru and Karnataka at large registering some of the largest numbers. Karnataka has reported its single biggest single-day spike with over 50,000 cases, like I just told you, in the last 24 hours, with 346 deaths. Bengaluru alone accounts for nearly half of that total surge, after it reported 23,106 new cases and 161 deaths on Wednesday. The surge comes even after the state is under strict restrictions to curb the continuous rise of COVID cases. Chief Minister Yediyurappa had earlier said that curbs already in place will continue for now. The state is under a strict close down till May the 12th with a 6-hour daily window for shopping of essentials. Yediyurappa also said that a decision on extension of current restrictions or a complete lockdown will be taken at a later stage closer to May the 12th. Let's go straight across to India Today's Nolan Pinto for more. Nolan, Karnataka, especially Bengaluru, definitely emerging as one of the new epicenters of India's COVID crisis.
Absolutely, Shiv. In fact, what really happened yesterday changed everything. As of today, Karnataka has close to 490,000 active cases. Out of that, 313,000 active cases are from Bengaluru urban itself. Now, this is the epicenter because when you're comparing the active cases, it's about 6 times much more than Mumbai and 3 times much more than Delhi. So if you're looking at the first wave, that was mid-October, the maximum active cases in Karnataka was about 66,800 odd cases. You're looking at from there to what it is today. Now, like you rightly stated, on the 12th of May, that is when the lockdown, the corona curfew ends. But many people are experts, especially, are asking the Chief Minister to extend it. What the Chief Minister stated is that on the 10th of May, he will actually take stock of the situation and then decide whether or not to extend the lockdown. But experts want a very, very strict lockdown in Karnataka if the state needs to actually control the cases and break the chain. Otherwise, it's going to be extremely difficult, with people finding it very difficult to find beds, ICUs, and also oxygen supply.
Karnataka so far has failed to break the chain. Let's hope that happens soon. The numbers definitely very disheartening. Thanks very much, Nolan, for getting us the latest. Staying with Karnataka, I wanted to bring you these heartbreaking images from the city itself, where a helpless family was found on the road in the most VIP part of Bengaluru. After testing positive, they couldn't manage to find a hospital bed in the city, and they decided to sit right outside Chief Minister B.S. Yediyurappa's residence along with their suffering patient. The police then took the details of the patient and shifted them to a nearby hospital. These heartbreaking scenes in VVIP Bengaluru, right outside the Chief Minister's residence. Meanwhile, a group of COVID heroes in Chennai has launched a novel Oxygen on Wheels drive to provide succor to those desperately in need. The Jain traders' body is helping numerous patients in Chennai gasping for emergency hospital beds outside those institutions by making makeshift oxygen dispensers using school buses. Pramod brings us this story.
Tamil Nadu is one of the worst hit states battling the second wave. The state currently has nearly 1.19 lakh active cases, with at least 2,000 people testing positive every day. And with that, the need for hospital beds and oxygen has also gone up. Patients and their relatives are struggling to find beds. Some are lucky, several others lose the battle, gasping for air. Jain International Trade Organization has come up with an innovative idea called Oxygen on Wheels to help fix the problem. And it's a first of its kind initiative in India. Several school buses, which are currently not being used, have been modified to accommodate 6 patients each and are fitted with 6 oxygen concentrators and oxygen cylinders to help patients waiting outside hospitals.
We saw a lot of ambulances waiting outside for the patients to get in because there were no beds. So we said till the time, like a transit period, till the patient gets a bed inside, we should create a facility, because what was happening is the oxygen level was dropping very, very fast. So we came out with this very innovative idea where all these buses, which are already, Jain institutions run by Jain organizations, these buses are of no use now because the schools are all closed. So we modified these buses.
4 buses have been rolled out for now. The buses are parked outside prominent hospitals in Chennai. The number of buses will soon be increased to 20. The organization hopes to expand the project even beyond Tamil Nadu.
When the patients come to a hospital, they have to wait outside of the ambulance, waiting for a bed to be made ready, and especially oxygen. So NGOs have come forward. They're trying to bring something as a bus, which is converted to a place where you can get oxygen. In this bus, a minimum of 6 patients are allowed, and there they could get oxygen until they get a bed inside the hospital. Such innovative techniques are also being followed, but the need of the hour when it comes to Tamil Nadu is increasing beds and oxygen points. This is what medicos are advising the state government. With video journalist Daniel Pramod Madhav for India Today.